Hello, and welcome back to another episode of the Revitalize Women podcast. I'm Dr. Brenda Heineke, and I am super excited to talk to you today about fertility, particularly what we do here at Revitalize Physical Therapy to help optimize fertility and really help women that are struggling with infertility issues be able to conceive. So I thought that this would make a great podcast episode because we can really dive in deep to some of these things. And if you are interested in learning more about our program, or even just reading more information on some of the causes of infertility and some of the aspects that we address, I will link a couple of our articles that we have off of our website. I'll link to those in our show notes, so then you can check those out whenever you want. So to dive in here, I wanted to just really start off by saying that infertility is a really big issue that a lot of women are dealing with. And to kind of kick it off, I thought it would just help to kind of define a few terms. So to begin with, there's a lot of different causes of infertility. Infertility is technically defined as you've been trying to conceive for over a year and it hasn't happened yet. So when we look at some of the causes of infertility, it's kind of broken down into thirds. So 1/3 is due to an issue with the male, 1/3 is a known issue with the female, and 1/3 really they just don't know why. It's kind of unexplained. To dive in a little deeper then, just an example of certain issues, you can have problems really, I'm going to focus more on like the female end of it, just because we don't treat male pelvic floor here at Revitalize, and so while there are things that you can do to help with some of the issues that men deal with in terms of fertility, it's just not our specialty, so I'm not going to touch base on that, but just know that there are definitely still things that you can do. So looking at some of the known female causes, a lot of it has to do with issues within some of the reproductive organs themselves. So certain types of disorders like PCOS or endometriosis can affect fertility. Then we also look at the uterus, the fallopian tubes. We also look at your ovaries and how all of that is working properly. And so sometimes they can find certain issues like a fallopian tube is blocked, or maybe there's an issue with the uterus like fibroid or polyp. But oftentimes it's kind of unexplained. And so that's something that we focus on, and I'm going to talk about in a little bit deeper with just how the all the different parts and organs are working properly. And I kind of lump that into sort of like a mechanical cause for infertility. Then we also look at issues with the quality of your eggs, or even the number of your eggs. And so there's a lot of things that can affect that. A lot of different lifestyle things. So potentially not having enough body fat, if you have a lot of hormone issues or abnormal menstrual cycle. Also, things that are known to affect fertility would be smoking, drinking. Really, what it comes down to is inflammation throughout the body. So with infertility, a lot of the causes, if you will, kind of stem from just too much inflammation throughout the body, and that's affecting how everything is working. So if we look at your menstrual cycle, and if you're having abnormal menstrual cycles, a lot of things can factor in for that, but a lot of those factors ultimately lead to inflammation. So that's something I'm going to focus on, but I thought I would just kind of define a few things. And then lastly, there is a difference between primary and secondary infertility. So secondary infertility is where you've already conceived, you've already had a baby, and now you're struggling to conceive a second time or subsequent time. Primary infertility would be you haven't conceived at all previously. So a lot of the secondary infertility issues that women deal with are very much unknown because they already know that your body's been able to successfully have a pregnancy full term. And so either it kind of comes down to some issue within your hormones or your thyroid, or mechanical issues. So we're going to kind of dive into all of that. Before we dive in though, I do want to talk a little bit about what we do here at Revitalize, because this is kind of a pretty new cutting edge thing. Not many physical therapists do this kind of work. We've had to do a lot of advanced training, advanced coursework, and it's taken us a long time to develop this program. And there's only, kind of a handful of us around the country that are doing this type of work. So what we have done here is essentially develop a program that helps optimize your fertility. And we do this using two approaches essentially. So we have a physical therapy approach where we're addressing some of these mechanical limitations or impairments that we are going to talk about in just a second. And then we also have a functional health component too that really ultimately addresses that inflammation aspect. So we have clients that kind of do the two-prong approach with both of those, and then other clients that are coming to us that have done a lot of things that we would do as part of that functional health aspect. And so we might just be doing the hands-on manual treatment for it. So kind of two different approaches, but this program we rolled out early in 2021 and have been working with women and kind of fine-tuning this approach over the last several months. We also work with women that are currently going through fertility treatment to help optimize it. And everything that we're doing is backed by research. We've kind of pulled all different components from the research when we've combined this program, or I should say designed this program. And so there is research that also supports a lot of this work with optimizing fertility treatments. Even you're predicting your success of IVF is one of them. So it's really cool. I have found this work so fascinating and so rewarding too. And it's really, really cool that we can impact women's bodies like this. And I just think that it's such a great first step if you're struggling with infertility, because it's non-invasive, it's relatively low cost compared to a lot of fertility treatments. So it's a great kind of first step. And it's going to address a lot of the factors. And then if ultimately you still do fertility treatment, you would have a much higher success for an outcome. So super, super cool. I am loving the work that we're able to do with women on this. And I just really think that everyone needs to know about this because it's so new and just so many people have zero idea that this is even out there. So spread the word, tell all of your friends. But yes, I just can't believe that we're able to do these things. It really blows my mind. All right, so to dive in a little bit, what we're going to talk about is some of those causes, if you will. And so I've talked a lot about inflammation in the body. And so what we're doing with our functional health component of the program is ultimately trying to address inflammation. So a lot of the factors all stem towards decreasing systemic inflammation in your body, because that's really going to impact fertility. I will also link in the show notes to a video that I did that talks a little bit about the biochemistry if you're interested in learning more. If you want to get really scientific, it's called the pregnenolone steal. And ultimately, what happens in our body is we only have so many resources, if you will, to ultimately create our hormones that we need for healthy fertility. So we take cholesterol, which is good fat, we take that and create it, basically break it down to create our sex hormones, progesterone, estrogen, and testosterone. We also use it to create cortisol. And so when our body is stressed or under inflammation, it'll take more of that resource to create cortisol, and it'll stop producing the sex hormones that we need. So that's a really big factor, and that's why we have a whole subset on stress within our program. And so really cool to check out if you like to get a little sciencey and learn a little on the biochemistry pathways for our bodies. So we'll talk a little bit more about that in a second, but check that out if you're interested. So what we do in our program, we break it down into a couple different components. So we have stress, we have nutrition, and we also have a detoxification process. Then we also do tracking to make sure that you truly are ovulating, because we have had women come to us that aren't ovulating. And so that's kind of step one, that needs to happen. So we need to look at why that is and what are some of the factors that we need to address in order to get you ovulating and have a healthy cycle. This is why it's super important that you have a healthy period. A lot of us probably have never thought about that or really have given it much effort. Most of us have probably always thought, oh, it's just normal. You know, you think of a lot of cramps or heavy periods, painful periods, irregular periods, and we just think this is just normal variability, but it's really not. There's a great book called The Period Repair Manual. I highly recommend it for anyone really with any kind of period issues, but especially if you are dealing with any kind of abnormal cycle or irregularity, heavy periods, painful periods, PCOS, endometriosis, any of that. This book is a great read, so I'll also link to that. But it's just really important that you are having a healthy cycle and that you are ovulating, because that's step one. So diving in a little bit, we first deal with stress. So stress, as I've said, can be a huge factor on fertility, because your body will essentially shunt resources to make your sex hormones to ultimately make more cortisol to handle the stressful reactions that our body is encountering. So what we do in our program is we utilize a software called HRV, stands for heart rate variability. And this has been around for a while, but it's more recently being heavily studied in the research for a lot of different reasons. But they are starting to use this on studying infertility. So there's a great research study that actually uses HRV to predict the success of an IVF cycle. So super cool. But what it does is you wear EKG leads, and it monitors heart rate, and it also monitors the variability between beats of your heart. So it's different than just looking at heart rate. but ultimately, depending on what that ratio is for HRV, will determine, is your body reacting to a stress response or is it in recovery? And so these are the two different nervous systems that we have, our sympathetic and parasympathetic. And so it tracks all of our stress reactions throughout the day. You wear it for at least 3 days overnight. So it also monitors how well you're sleeping. You might think that you're sound asleep, you had a great night's sleep, but your body may have been in stress state for a good chunk of that. And we also use it to look at how is your body recovering from workouts? What are the patterns? For example, is there a certain time of day that your stress reactions are spiking? And so we do this and kind of analyze the 3 days and look at what are some of the factors that are ultimately providing more stress. And then are you able to have recovery? Because our bodies will always have stress. We need stress to survive. It's just a normal part of everyday life. You're never going to eliminate stress. And so, stress can be anything from a ping on your computer when an email comes in, to your blood sugar crashing after you've eaten a meal, to maybe driving to work or having a glass of wine at night. So all of these things can elicit the stress response. Our role isn't necessarily to eliminate stress, but it's to make sure that we're having adequate recovery so that they're balancing out. That would be considered healthy. So that's super important. And then we kind of work with you to develop a plan to essentially get more recovery in. I would say for most people, the issue is too many stress reactions throughout the day, not enough recovery. And so we need to look at how to balance that a little bit better. That's step one. And I know it might sound kind of silly, and I think some people have been told you just need to relax more. You've probably heard stress can impact fertility. This at least is using a more scientific approach and trying to give you a plan to help balance it, because like I said, stress is never going to go away, and we're not trying to eliminate it. We're trying to balance it. So that's step one, stress. Then what we do is we move on to our detox phase. And I don't necessarily like the word detox because I think it's become a buzzword that implies a lot of different things. So I don't love that word, but ultimately what we're doing is detoxifying the liver. So what we do is for 7 days, we try to eliminate anything that creates inflammation and can affect how our liver metabolizes. So pretty much everything we put into our bodies, the liver has to break it down. And so any kind of environmental toxin that we come in contact with, even our hormones, every month when we cycle through, estrogen has to get broken down and metabolized. All of that runs through the liver. The food that we eat, the products we put on our bodies, etc. So what we do is we actually utilize a couple different supplements that provide the amino acids specific for liver detoxification. So you add this in every day. You take these supplements. You also eat a healthy diet for the week. So this isn't like a 500 calorie a day juice cleanse, nothing like that. What we're doing is we're eliminating some of the problem foods like sugar, alcohol, gluten, dairy. So if you can kind of cut that out for a week, make sure that we're also getting foods that naturally help the liver detox. So for example, broccoli is a great option. We try to incorporate that as much as possible. And so you go through that, and it really just helps kind of flush everything out. And I will say, if you have taken hormonal birth control in the past and never done anything to try to like detox the liver, a lot of times the hormones from that birth control get built up in the liver. They found in the research that our body kind of holds on to that. And so it's really important that we try essentially to flush that out before trying to conceive. So it's important that we're doing this before doing any kind of fertility treatment, because when we are doing this detox, you don't want to also be trying to conceive or potentially be pregnant, because you don't want to release some of these not so great chemicals and toxins that your liver might have release into the body and potentially have some impact on a tiny little baby. So we do that as step 2. Then moving on, we do focus a little bit on nutrition, and we kind of leave this up to you and what you're comfortable with, because for a lot of people, they might not be willing to make as many changes as others. And so we recognize that, and we want to work with that. So one of the things that we do recommend is trying to cut down on sugar. Sugar is a huge culprit of creating inflammation in the body. Sugar and alcohol. So those are the two things that we really say you really need to try to cut out of the diet and minimize as much as possible, because that's the number one cause for systemic inflammation. Then we also look at gluten, because there's been research that has suggested that some people have celiac disease, which would be a gluten allergy essentially, and the only symptom that they have is infertility. So they have none of the other classic symptoms of celiacs. And so again, gluten can also create inflammation. And so we try to eliminate that if you're open to it. Then we also focus a little bit on gut health, because gut health is huge. A lot of the foods that we eat or things that we take in, like gluten or sugar, they wouldn't be as detrimental on us for creating inflammation if we have really great gut health. The problem is a lot of people don't have good gut health. And so you might not have a great balance of good bacteria versus bad bacteria. And you also might not have the right kinds of good bacteria. And so we kind of take a deeper dive into that and work with people utilizing prebiotics and probiotics to make sure that we're healing the gut and providing good, healthy gut bacteria. So I won't get too much into gut health, but it's a huge area with emerging research linking gut health to so many of our common health issues right now. So we also kind of dive into if you're dealing with any kind of constipation, would also kind of indicate some gut health factors as well. So all things that we try to address and help, because ultimately this really plays a big factor on optimizing your fertility, optimizing the quality of your eggs, and really making sure that you're decreasing the inflammation so that you're giving your body the best possible chance to conceive. I will also say that some of the things that we do encourage, like eating good healthy fat, is super important too. I mentioned having cholesterol in order to create our sex hormones, and so a lot of people might not be taking in adequate amount of good, healthy fats. So that's something that we want to focus on, and just really kind of optimizing the quality of the food that you're eating while you're trying to conceive. It can be a big factor. So trying to do organic or grass-fed beef if you can, because this all decreases inflammation. If you're eating potato chips and Kool-Aid, I don't know, it's just what came to mind, that's just going to create more and more inflammation, and your body is just not going to be in the same place to conceive. So if you're struggling with fertility, highly recommend doing some of these things, and kind of assessing some of these dietary and lifestyle factors for yourself. Then we get into some of those mechanical factors that I talked about. So everything we just talked about, our main goal with that is kind of addressing the inflammation in the body. Then we have the mechanical aspect. And so this is where our manual skills come into play as physical therapists. And so we've done a lot of advanced training to learn specialized techniques that look at cervix mobility, the uterus mobility. There's a lot of ligaments that attach to all of these places, like the cervix, the uterus, the ovaries. All of this has connective tissue, fascia, ligaments surrounding it and connected to it. And so if things aren't moving how they're supposed to be, it can affect how the egg gets transported and how the sperm gets transported. So we really want to make sure that everything is in the correct place that it should be and moving the way it should be. There's also a study that looked at some of the techniques that we do actually improves the quality of the cervical mucus, which is really important when you ovulate because it helps transport the sperm to the egg. So looking at some of those factors is part of what we do with some of our hands-on skills. So we will work kind of a combination externally and internally doing some of these techniques. We also want to break up adhesions. So if you have had maybe a history of abdominal surgery or injury, there's likely to be scar tissue and adhesions. And again, that's going to impact the mobility. So a good example I always use is the fallopian tube, because it's this really, really tiny space that the sperm has to swim through. And so even just the slightest twist of that tube or torsion can decrease the ability of the sperm to pass through the tube and get to the egg. So we want to basically avoid any kind of restriction or limitation that would be pulling on those areas that would create this torsion or this rotation. So that's just like a really good example of some of the things that we're doing. And then we're also addressing some of the pelvic floor, because if the pelvic floor muscles are tight or restricted, it can also impact fertility. And then the last piece of it is looking at pelvic congestion. So this is kind of where blood flow and your lymphatic system just isn't draining properly. So things can kind of just get stuck in the pelvis and they just don't drain. And that has been shown to play a big role in infertility. So women that have more severe congestion, pelvic congestion, have lower rates of success from this type of treatment. So trying to get that kind of cleared and get it moving is a big goal of ours. So I hope that this helps kind of explain what we do as our fertility program and really how we're addressing it and coming at it. So Again, there are certain things that we are not going to make a big change with. Some of the ovarian insufficiency diagnoses would be really hard for us to make a big impact. Sometimes we also will utilize other practitioners like acupuncture to help stimulate and get things going. For example, if you're not ovulating. And so we kind of come at it from this approach, but knowing that there's so many factors, so many different things. And so we do really like to collaborate with other practitioners within the fertility space to really make sure that you're getting exactly what you need. And so you're not wasting time or money or energy. So I hope this helps kind of explain it. If you have any questions at all, or if you're interested in learning more, feel free to reach out. We'd love to talk and love to see if you would be a candidate for our program here and to see if we think we would be able to help you. So leave your comments, and if you're loving what you've been hearing lately, make sure you like and subscribe, and don't be afraid to leave us a review. We'd love to read it. And I will see you all on another episode of the Revitalize Women podcast.